You're 8 months pregnant, finally exhausted enough to sleep, and you've arranged your fortress of pillows just right. Then you wake up at 2 a.m. on your back, heart racing, wondering if you've just harmed your baby. You shift to your left side like you've been told, but your hip screams in protest. You flip to your right, but guilt creeps in. You're awake now, uncomfortable and honestly confused about whether any of this positioning actually matters or if you're overthinking everything. If this sounds familiar, make sure you're subscribed so you don't miss any of our pregnancy health guides. If you've spent any night of pregnancy negotiating with your body about sleep positions, you're experiencing one of the most universal physical struggles of pregnancy. The anxiety about sleeping wrong is real, the discomfort is legitimate, and the conflicting advice you've received has probably made this harder, not easier. Here's what you need to know. Sleep positioning in pregnancy balances real physiological considerations with the practical reality that perfect positioning is impossible. Your body will often tell you what it needs if you know what to listen for. Let's start with something that might surprise you. In your first trimester, you can sleep however you want. Your uterus is still protected by your pelvis. Stomach sleeping is completely safe even if it's getting increasingly uncomfortable. There's no risk to your baby when you're on your belly during these early weeks. Your body is designed to protect that growing life, and right now, your pelvic bones are doing exactly that. The second trimester is when things begin to shift. After about 20 weeks, you'll want to start transitioning away from back sleeping. This is when your uterus grows above your pelvis and begins to get heavy enough to matter. But notice I said start transitioning. This isn't an emergency switch that happens overnight. You're building a new habit before it becomes medically necessary. By your third trimester, side sleeping becomes essential. Here's why. When you lie flat on your back, your growing uterus can press on a large vein called the inferior vena cava. This is the vein that returns blood from your lower body back to your heart. When it gets compressed, blood flow decreases. That means less blood circulating to you and less blood flow to your placenta. Now let's talk about the left side versus right side conversation because this is where a lot of guilt lives. The left side recommendation exists because sleeping on your left optimizes blood flow. Your uterus naturally rotates slightly to the right during pregnancy, so left side sleeping keeps it from pressing on that inferior vena cava we just talked about. It improves circulation to the placenta. That's the science. But here's the reality check you need. Right side sleeping is not dangerous. It's still far better than back sleeping. It's completely acceptable if left side becomes uncomfortable. Your body needs rest more than it needs perfect positioning. If your left hip is aching so badly that you can't sleep, rolling to your right side is absolutely fine. And if you wake up on your back, take a breath. Waking up means your body's protective systems are working. Simply roll to either side without anxiety or frustration. Your body will typically wake you if you're positioned poorly for too long. Occasional back sleeping, especially if you're propped at an angle, is not catastrophic. This matters because the stress of sleeping wrong often causes more harm than imperfect positioning. So, how do you actually make side sleeping comfortable? This is where pillow architecture comes in. And I mean that specifically. Generic use pillows advice fails because it doesn't address the actual mechanical stresses pregnancy puts on your body. Here's your setup. Place a firm pillow between your knees. This prevents your hips from rotating inward and reduces pressure on your lower back and sciatic nerve. That shooting pain down your leg, this pillow placement helps prevent it. As your belly grows, position a small pillow under your abdomen. This supports the weight of your uterus and reduces strain on your back muscles. You're essentially creating external support for what your body is working hard to hold up all day. Behind your back, use a wedge pillow or a rolled up body pillow. This prevents you from rolling fully onto your back while still allowing a slight recline. You're not aiming for perfectly perpendicular side sleeping. A gentle angle is fine and often more comfortable. Under your head, make sure your neck stays aligned with your spine. Proper neck alignment reduces shoulder pain and helps prevent reflux from creeping up your esophate when you're lying down. Full body pregnancy pillows, those C-shaped or U-shaped ones, can provide all this support simultaneously. They're worth considering if you're struggling to get the architecture right with regular pillows. But you don't need expensive equipment. Strategic placement of what you already have works perfectly well. Now, let's address what you're actually avoiding and why it matters. Flat on your back after 20 weeks can cause something called supine hypotensive syndrome. You might feel dizzy, you might feel nauseated. Blood flow to your baby decreases as your uterus compresses those major blood vessels we discussed. This is a real thing. Stomach sleeping becomes physically impossible as you grow, but it's not dangerous when it's still possible. Your body will tell you when it's time to stop. Listen to that signal. Sleeping completely flat without any elevation can worsen reflux and breathing difficulty regardless of which side you're on. A slight incline helps with both. But here's your reassurance. Waking up briefly on your back is not an emergency. The risks develop with sustained back sleeping, and your discomfort system usually wakes you before that happens. If you wake up on your back, you've already done the right thing by waking. Just roll to your side and continue sleeping. Let's tackle the specific disruptions that are probably making any position difficult. Frequent urination is wrecking your sleep. Here's what helps. Stop drinking 2 hours before bed, but stay hydrated earlier in the day. When you use the bathroom, lean forward slightly. This helps you empty your bladder completely. Use dim lighting for bathroom trips. Bright lights suppress melatonin and make it harder to fall back asleep. Hip pain from side sleeping is incredibly common. Switch sides throughout the night instead of forcing yourself to stay on one side all night. If your mattress is soft, consider adding a firm topper. During the day, strengthen your hip stabilizers with prenatal exercises. Stronger muscles support your joints better at night. Reflux burning in any position. Elevate your upper body 30 to 45 degrees with a wedge pillow. Avoid trigger foods 3 hours before bed. Try sleeping on your left side, which reduces acid exposure to your esophagus. Shortness of breath keeping you awake. Prop your upper body higher. Use additional pillows behind your back to prevent lying completely flat. If needed late in pregnancy, sleeping in a recliner is a completely reasonable solution. Comfort and rest matter. Each of these solutions addresses the specific cause, not just the symptoms. Your body is working incredibly hard right now. These adjustments help it work a little easier. Here's your protocol for when you wake up in a position you didn't intend. First, take a breath. Waking up means your protective systems are working exactly as designed. Second, simply roll to your left or right side. No anxiety, no frustration, no guilt. Third, readjust your pillow support if they've migrated during sleep. They probably have. Fourth, if you're waking repeatedly uncomfortable, this is information. You may need different pillow placement. You may need firmer support. You may need to vary positions more. Don't aim for motionless perfection. Pregnancy sleep involves shifting positions. That's physiologically normal. Your goal is to spend the majority of sleep time on your side, not to achieve perfect stillness. Now, let's talk about when sleep position becomes a real concern that needs medical attention. Contact your provider if you experience sustained dizziness or nausea when lying down. If you have severe shortness of breath in any position. If you notice sudden swelling that's worse on one side. Or if your baby's movement decreases, though this is rarely position related. These symptoms suggest issues beyond positioning. They need evaluation. However, general discomfort, frequent position changes, difficulty finding comfort, and occasional back sleeping are all normal pregnancy experiences. They're not medical emergencies. Understanding this difference matters. It separates normal pregnancy sleep challenges from symptoms requiring evaluation. It reduces unnecessary anxiety while ensuring appropriate vigilance. Your body is designed to protect your baby. It will wake you when positioning becomes problematic. It will signal discomfort before danger develops. Trust those signals, respond to them. But don't let perfect positioning anxiety steal the rest you desperately need. You now know exactly what positions to prioritize and why. You know how to use specific pillow placement for your particular discomfort. You understand what actually constitutes risk versus normal variation. You have a clear protocol for when you wake up in non-ideal positions. And you know which symptoms require provider contact versus self-management. Sleep in pregnancy is genuinely difficult. Disrupted sleep is universal. But you can approach each night with informed intention rather than anxious perfection seeking. Your body will guide you. The science supports you, and imperfect sleep that actually happens is infinitely better than perfect positioning that keeps you awake. you're doing better than you think. Your baby is safer than your 2 a.m. anxiety tells you, and tonight you'll sleep a little easier knowing exactly what matters and what doesn't.